The FDA advisory panel met today to discuss booster shots, in particular booster options for those who've received the Johnson & Johnson vaccine. News 4 Tucson's Eric Fink joining us live from the South Side with more on today's meeting. Eric, what are you learning tonight?
And Priscilla, that FDA advisory panel says boosters are a go for those who got the single-dose COVID Johnson & Johnson vaccine. The recommendation is that booster should come at least 2 months after the original shot. But should J&J folks actually get the J&J booster? One recent study says it's best to mix and match. With the FDA advisory panel giving the green light to a booster shot for Johnson & Johnson, all 3 COVID vaccine boosters have been given emergency use authorization. A study this week from the National Institute of Health shows a Pfizer or Moderna booster could provide more protection for people who first opted for the single-dose J&J.
When folks received a booster of J&J, they got about 5 times more antibodies when they measured antibody levels. But when they mixed and matched it with an mRNA vaccine, they showed that there was about 50 times more antibody response.
In J&J, the efficacy in terms of preventing disease was not as effective as Pfizer and Moderna. The belief is that boosting with Pfizer and Moderna will give you additional protection against acquiring the disease.
When the vaccines were rolled out, mix and match was widely ruled out. But 10 months later, the science could be showing something different.
In this case, the issue is, will we see ability coupling J&J, which is a totally different vaccine, with a messenger RNA vaccine, either Moderna or Pfizer? If we do mRNA, are we more likely to prevent disease from occurring? So you're less likely to get COVID.
A CDC advisory committee is expected to meet next week to give more guidance.
I think there's going to be confusion because we know the scientific evidence is saying that antibody response is greater with a mix and match, but we will have to follow the rules outlined by the FDA and CDC. So it'll be curious to see what the CDC tells us on Wednesday.
And mixing and matching vaccines would require an amendment from the FDA on current COVID-19 vaccine authorization and the green light from the CDC. We will keep you posted on all of this. We're live tonight here on the South Side of the Pima County Health Department. I'm Eric Fink, News 4 Tucson.